So what we're going to look at today is paediatric resuscitation. There are slight differences to how we would do with an adult compared to baby, child and adolescent. Okay, so for a baby, it's under 1 year old. For a child adolescent, we're looking at 1 to 12 being a child and 13 to 17 being an adolescent. Okay, so I'll highlight some of the differences as we go along, but your doctor ABCs still remain the same in that order, but there are little changes within that order. Okay, so let's have a look at a child adolescent. So I come into an area and they're already on the floor, or it could be that I've witnessed a collapse in front of me. Okay, first thing I'm going to do is I'm going to call for 999. Okay, before I do anything. From there, I will check the area for danger before I approach, because I don't want to put myself at risk as well. There's no point in having two casualties. So I'll check the area. When I approach, I will try and get a response. So I will look for a verbal response from them. John, can you hear me? Can you open your eyes for me and squeeze my hand? Go to both sides of the head, because they may have a hearing impairment and they don't have their hearing aid in, or their cochlear implant connected, or there could be other reasons why they have a loss of hearing. So it's important that we go to both sides. I'm getting no response from them. So what I'm going to do now is I'm going to apply some physical discomfort to see if I can get a response from them. So I will gently tap the collarbone, and I will squeeze the trapeze area just at the top of the shoulder there, gently but firmly, to see if I can get a response, and there is no response. So what I'm going to do now is I'm going to check the airways to see if they're breathing. So the airway needs to be nice and open. From here, I'm going to check the mouth to see if there's any blockages. So just take the chin down towards the chest area, have a little look, see if there's any foreign objects. If there is no foreign objects in there, what I'm going to do is I'm going to tilt the head back far enough so the nose is pointing to the sky, and from here, that's what we call sniffing the air. That is enough for a young child. An older child, I'd be tempted to take the head all the way back there. Okay. I will then check breathing for 10 seconds. Now, the younger your casualty, the more breaths that they will take in those 10 seconds. I'm looking for the rise and fall. I'm trying to see if I can feel any breaths on the side of my face, and I'm trying to hear to see if I can hear anything such as wheezing, stridor breathing, gargling noises, snoring sounds, because with children it tends to be respiratory rather than cardiac. Okay. So they're not breathing. Now, before I start chest compressions, what I want to do is give 5 rescue breaths. Now, to give those 5 rescue breaths, all I'm going to do is squeeze the nostrils closed, so when I breathe in, it doesn't come out through the nose. Tilt the head back, lift the chin up. I will create a seal with my mouth around their mouth, and I will blow gently just enough to get a little rise on that chest. So 5 rescue breaths. And then I will start my chest compressions. I will start with one hand, so I'll put the heel of my hand to the centre of the chest there, and I'm looking to go down 1/3 of the depth. So I'm using my body weight. Now, if I cannot get 1/3 of the depth here, I will then switch onto both hands, and I will start my chest compressions. 30 to 2. 25, 26, 27, 28, 29, 30. Stop. Two rescue breaths, and then I'm back on the chest there with either one hand or two hands. So once you've given that initial 5 rescue breaths, you're then on 30 chest compressions to 2 breaths thereafter. So while you're doing your chest compressions, hopefully somebody has gone to get a defib. If you're on your own, I would do chest compressions and breaths for up to a minute before I go and get a defib if I'm on my own, and that's only if it's within reach. Okay, so a defib will tell you and give you instructions. You can get adult pads, you can get pediatric pads. Some defibs will have both the adult and pediatric pads with it. Some defibs will have a little switch where you can switch from adult to pediatrics. So for a a child, what I want to be doing is placing the pad just off the centre over towards the left hand side, and at the back is going to be dead centre. The defib will give you instructions, so when you turn it on, it will start speaking to you. Take out the package, open up the package.
Remove square package from lid of AED.
You'll have paediatric pads, okay?
Peel
So for a child,
completely from blue plastic.
I will place it just off centre on the left hand side, and the one on the back, I will look to put on
without the blue plastic on the patient.
To the centre of the back there, between the shoulder blades.
Second white pad from the blue plastic.
Listen to the instructions.
Firmly place the second pad on the other location. Firmly place the do not touch the patient. Analyzing rhythm.
So it'll tell you not to touch the patient because it's going to be analysing the heart rhythm.
Do not touch the patient.
It'll tell you either a shockable or non-shockable rhythm.
Press red flashing button to deliver shock.
You have a little red button.
Flashing button to deliver shock delivery.
Press it, and then go back onto the chest there to start your CPR again. Okay, whether it be one hand or whether it be two hands. For a adolescent, the pads would be the same as what you would do on an adult. It would be the top right hand side, just under the collarbone.
Give breath.
And the second pad would just be below the armpit, the lower left side. And this is what it would look like. Okay. Again, follow the instructions.
Do not touch the
Do not touch, so stay back. It'll analyse the rhythm.
Shock advised.
It'll tell you shock advised or no shock advised.
Press red flashing button to deliver shock. Press red flash shock delivered.
From there, one hand.
Start CPR.
Or two hands. And we will do this continuously until such times as the paramedics arrive. So that's that for the child adolescent. If you have no defib, you would just If you have no defib, we will just continue with the chest compressions and breath until such times as the paramedics arrive. Now that we have had a look at the child adolescent, what we're going to have a little look at now is we're going to have a little look at babies. Okay, so slight differences from the child and adolescent to the baby. Okay, the responses, trying to get a response from a baby will be different. Okay, so what I'm looking to do is make a lot of noise round about the head to see if the baby will respond to that noise, maybe turning the head to where that noise is coming from. Gently shake the shoulders a little bit, just firmly but gently, see if I can get a response. I may pinch the ear to see if I can get him to cry. I may run my nail up and down the foot there to see if I can get a knee-jerking reaction there. Okay, I'm getting no responses. I am now going to check the airways and check for breathing. So I'm going to have a little look in there, see if I can see anything. If there was an object in there, be really careful. If you're going to put your finger in there, be really, really careful you're not shoving that item further down. It could be that you turn the baby onto its back, have it at an angle, and give a couple of back blows there between the shoulder blades to see if I can get that item out. If there is no item there, no foreign objects, I will keep the head in a neutral position. So the child and adolescent will be tilted. For babies to have an open airway, we keep the head in a neutral position. So from here, check to see if I can see any rise and fall of the chest or rise and fall of the stomach there for 10 seconds. Now for babies, during that 10 seconds, you're probably looking at anywhere between 7 to 10 breaths in those 10 seconds because the lungs are really, really small, isn't it? So the baby's like, that's how they breathe, isn't it? It's really, really fast. Okay, so from here, check for 10 seconds. They are not breathing, so I will give 5 rescue breaths. Now to give 5 rescue breaths for a baby, I will seal both the nose and the mouth because it's so close together. And I'm only going to be using a mouthful of air. Really, really soft and not a lot because we don't want to overinflate those lungs there. Okay, so from here, and then I will start my chest compressions. Now, to give chest compression for a baby, we will be looking to put one thumb in the centre of the chest there, my other thumb will be on top, and my hand will just go around the rib cage from here. Third of the depth, 2 per second. 30 that we're looking to do, okay? 25, 26, 27, 28, 29, 30. I will then give 2 rescue breaths, and then back on the chest there. Now, with someone else who is skilled in mouth to mouth, we can go down as low as 15 chest compressions to 2 breaths, but if not, just keep it at 30 to 2, 30 to 2 after those rescue breaths. Now, to apply the defib, okay, same with listen to the instructions, take the pads out, but this time I will place one pad
Remove square package from lid
on the
of
centre of the chest, and the other pad
Peel one of the white pads
is
completely
going to
from
go
blue
on
plastic.
the back of the chest there, dead centre.
Peel one
Place
of
the
the
baby
white
back
pads
down
completely from blue plastic.
and carry on listening to the instructions.
Firmly place the pad. Do not touch the patient.
Do not touch, so our hands will be off.
Shock advised.
It's telling
Do
me
not
shock
touch the
advised.
patient.
So I will press the button when
Press
it lights
red
up,
flashing button to shock delivered.
and then I will be back on the chest,
Start CPR.
back to that 30 to 2, 30 to 2, or 15 to 2 if I'm with someone else. Again, if I have no defib, I will continue with 30 to 2 or 15 to 2 until such time as the paramedic arrives.